Welcome to Alpha Coding Podcast, an all-access pass to medical coding and billing pro tips that help you start your week off smarter. And now, here is your host, Toni Elhoms.
Hello, everyone, and welcome to the Alpha Coding Podcast series. I am your host, Toni Elhoms. Welcome to episode 4 of the podcast. Today is January 27th, and I am so excited to report we have just passed 1,600 downloads of the podcast in our first month. That is incredible, and I cannot thank each of you, our listeners, enough. Your support truly means the world. Shout out to all of our listeners on YouTube, Apple Podcasts, Spotify. We really appreciate your support. And a special shout out to my business coach and mentor, Terry Fletcher. Without her, I would not be here on the air today with you. So I am eternally grateful to this woman. And if you haven't heard her show, the Codecast podcast, be sure to check it out. It's on all downloadable platforms every Tuesday on Terry Tuesday. I really enjoy recording these episodes each week and providing you with pro coding and billing tips in the form of solo podcasting as well as guest interviews and giving you some insight on how to advance your career. Also, I want to introduce you to a new tip that I'll be giving you each week. It's called the Mindset Monday tip. And my inspiration behind this was really to help you avoid having a case of the Mondays. We can all have a case of the Mondays. It's just that day of the week where we think about all of the things that are ahead of us and what we need to do to accomplish that very long to-do list. I can on occasion have a case of the Mondays, and I wanted this to be your Monday dose of positivity to get you into that growth mindset that is needed to tackle your week. But first, today's Mindset Monday tip is brought to you by Clara. Clara is a holistic, secure communication platform that reduces overhead costs to increase your bottom line. It automates day-to-day tasks like follow-ups and reminders, so your staff can focus on giving patients the exceptional experience they deserve. Mention my code ALPHACODING for 10% off. Visit clara.com for more information. So for our Mindset Monday tip, it's all about failure. I know you guys probably see a lot of my posts on LinkedIn about personal development and mindset. Thomas Edison said, "I haven't failed. I've just found 10,000 ways that won't work." Failure is all about perception, and most of our biggest successes in life come on the heels of what we perceive as failure. That couldn't be more true for me, and I'm sure it is for you as well. So fail big, because you never know what's on the other side. So let's dive into our topic for today, which is my pro tips for coding the social determinants of health. We first need to define the social determinants of health and what these mean. So according to the Centers for Disease Control, the CDC, social determinants of health are societal and environmental conditions such as food, housing, transportation, education, experiences, social support, and employment that can affect a person's health. Numerous studies have demonstrated a link between economic status, social factors, and physical environment as key influencers in health outcomes. And that's according to the CDC. So there's a lot of literature and research out there that indicates the social determinants of health directly impact your health and society at large. Many of you probably read my article in the January edition of AAPC Healthcare Business Monthly magazine. And if you haven't, be sure to check it out. It's got a really great example of how this looks in the real world. But hospitals and physician practices, as well as many organization types, are struggling with how to address the social determinants of health, how to capture the data, and what we can do to help these patients and address their very complex medical needs. And I literally have this conversation almost every time I meet with a hospitalist. They are on the front lines of this epidemic, and every day their number one concern and priority is patient care. And with these patients, they don't have a lot of resources, and continuity of care can be very difficult because they don't have access to the things that we take for granted every day, like a cell phone or a mailing address. So these details can really complicate the care and facilitation of care for these types of patients. So this brings me to my pro tip number 1, report coding social determinants of health data whenever appropriate. This requires you to know how to code the social determinants of health. I get this question a lot. What is it and how do you report it? Well, the social determinants of health are a classification of ICD-10-CM codes, and they are in categories Z55 through Z65. And you'll notice when you look at your ICD-10-CM manual, it won't have the label SDOH on these codes. So that's something that you'll need to know in regards to the CDC's definition of SDOH and how that corresponds to ICD-10-CM. I think that's where a lot of coders get confused. So Z55 through Z65 is where you'll want to focus your efforts when you're capturing this data. And if you look at Z56, for example, this category is defined as problems related to employment and unemployment. So if you actually go through and look at some of these codes, they're pretty interesting. So for example, Z56.2, threat of job loss, Z56.3, stressful work schedule, Z56.4, discord with boss and workmates. So there's a wide selection of choices, and some of them are more related to employment, whereas others are related to social and economic factors. It's a really good idea, if you have never seen these codes before, to go through each section and familiarize yourself with these codes so that you know they're available to you when you're going through documentation and actually abstracting codes. And the biggest thing I want you to keep in the back of your mind here is that when we report these codes, the SDOH codes, what we're really doing is we're saying that we need more resources and more allocation of funding for these factors and things that we can do to ultimately help the patients. So we've talked about what SDOH is, the importance of reporting it at any given opportunity. Now we'll talk about my pro tip number 2, which is knowing where to find SDOH documentation. Oftentimes, I see SDOH data recorded in ancillary sections of the medical record. So this might include the patient problem list or the social history section, or maybe there are notes about this patient in the patient portal messaging specific to challenges that you're experiencing with communicating with the patient or their non-compliance. All of these examples are places where you can abstract SDOH data and report it so that resources can be allocated to ultimately help these patients. And this brings me to my pro tip number 3. Know who can record SDOH data and documentation for coding and reporting purposes. So according to the 2019 ICD-10-CM guideline updates, social determinants of health code assignment may be based on medical record documentation from clinicians involved in the care of the patient who are not the patient's provider, since the information represents social information rather than medical diagnoses. This update is a game changer for coding professionals, especially because the majority of this SDOH data is captured by ancillary clinical staff that support the physicians. And this is pretty typical no matter what setting. So this might include nursing staff, medical assistants, and this means that they need to have the tools and the training and the awareness to record this documentation, and maybe even a consistent workflow so that everyone is capturing this data in the same place. This might look different for every organization, but you definitely want to understand who is able to record this data, where they're recording it, and how to abstract it for coding and reporting purposes. So let's talk about an example. We have a patient that is homeless, and this presents many barriers to the patient seeking care and actually executing on the plan of care that the provider has established. So we would want to report diagnosis code Z59.0 for this patient in addition to their medical conditions. Now, you want to make sure you don't put Z59.0 in the first listed diagnosis code. The reason being, there's a guideline that says it is not an acceptable principal diagnosis, which means you'll get a rejection. So make sure you put it in a second or tertiary diagnosis placeholder. And keep in mind, secondary and tertiary diagnoses, they do matter and they influence reimbursement, they influence quality measures, they influence so many different things. So you want to make sure that you're capturing it and you're educating your providers on the importance of documenting and capturing these additional codes. Data is king, and it's really important that everything is captured to give a clear and accurate picture of each patient. So this brings me to my pro tip number 4. Understand how to capture additional coding opportunities for SDOH patients. So it's one thing to assign diagnosis codes, but it's a whole different ballgame to compliantly report additional services that are being rendered to SDOH patients. I see this a lot of times when I do assessments. I'm brought in as a consultant to assess leakages and coding leakages, billing leakages. And this one comes up a lot. I see a lot of additional counseling or higher levels of evaluation and management services being rendered, but not actually being reported. And we discussed this in episode 2, where we talked about my pro tips for success in 2020. And this same concept applies here. We want to make sure that we are capturing all additional revenue opportunities for 2020. And there are a lot of new things that can be captured, and you want to make sure that you're taking a really good inventory on what those new services are, because a lot of times what I find is that the services are being provided, but they're not being reported. It's usually a case of not being aware that you can do this and it's an option, or maybe you're reporting it, but you're missing one or two little things that can make or break you in the event of an audit. I always advise my clients as part of their maintenance and compliance program to ensure they are capturing all revenue opportunities. And this is part of any revenue integrity program. If you want to learn more about revenue integrity, be sure to check out my webinar with Prof Ed On Demand. It's an on-demand webinar. It's called Demystifying Revenue Integrity, and it's got some great information about how to build a successful revenue integrity program. And be sure to let them know I invited you so you can get a discount. And this brings me to my pro tip number 5. Recognize the importance of SDOH data in the big picture. And my article in AAPC Healthcare Business Monthly magazine alluded to this, but data is king. And the more we as coding professionals can report the data and also educate our providers and our clinicians on the importance of documentation and capturing this data, the greater the impact we can make. And these patients need us because they are struggling, and we need to do our part to help them, because this is so much much bigger than any one person can fix. It's bigger than what the doctors can fix. It's bigger than what the nurses can fix. It's bigger than what coders can fix. But what we can do is work together collectively and align our efforts so that we can make an impact for these patients. So we as coders can make a difference, and we need to do our part. So to summarize, my top 5 pro tips for coding and reporting the social determinants of health. Number 1, report coding SDOH data whenever appropriate. Number 2, know where to find SDOH documentation. Number 3, understand who can report the SDOH documentation. Number 4, understand how to capture additional coding opportunities for SDOH patients. And number 5, recognize how important SDOH data is in the bigger picture. So if I've piqued your interest enough and you want more information about the social determinants of health, be sure to check out my ebook. It's going to be available for purchase next month, and it is an out-of-the-box solution on how to operationalize the social determinants of health. I can't wait to share it with you. So this concludes today's episode on my pro tips for coding the social determinants of health. I hope that this information will be useful to you, and I hope that you'll join me next Monday. But until next week, thank you for listening to Alpha Coding Podcast. We'll see you next Monday.
For more information about medical coding and billing pro tips, including how to hire alpha coding experts, follow us on LinkedIn, Instagram, Facebook, YouTube, or visit our website at www.alphacodingexperts.com.